So the next section of this chapter outlines how classical psychodrama techniques are inherently trauma interventions. So there's dozens and dozens of different psychodrama interventions and techniques, and I'm only going to be covering some of the main primary psychodrama interventions in this video. And I'm going to be covering them briefly. And so before trying to implement these interventions, it would be important that you see them in action and attend psychodrama trainings, rather than just watching this video and trying to incorporate some of these interventions. Without proper training and supervision, you have the potential of harming somebody with some of these interventions. So the three primary classical psychodrama interventions are the double or doubling, the mirror position, and role reversal. And these three interventions also reflect the three phases of Moreno's developmental theory, which we covered in the previous video on chapter 2 of the book. And here's a quote from Moreno in 1952, highlighting the connection between the interventions and the developmental theory. And so we might say that the double, the mirror, and the role reversal are like three stages in the development of the infant, which have their counterpart in the therapeutic techniques, which we can use in the treatment of all human relations problems. And if you wanted to dive more into this concept of how the psychodrama interventions of doubling, mirror, and role reversal can be used and guided by the developmental phases in psychodrama, I would encourage you to check out my previous book, Social Work, Sociometry, and Psychodrama. The chapter in that book on psychodrama interventions really goes into depth about using the developmental theory as a clinical map for guiding the interventions we choose to use in psychodrama. I'm not going to go into all of that in this video, but I would encourage you to learn more in my previous book. My 2021 book is actually available for free through the publisher, Springer Nature. You can download the entire book for free, either through the publisher or even on Amazon's Kindle book offerings. So the first intervention I want to talk about is doubling. So there's lots of different types of doubling, and I'm not going to go through all of them here. There's the role of the double, there's doubling statements, there's doubling that could come from audience members in the group. The therapist or the facilitator could offering doubling statements. There's the containing double, the cognitive double, the deepening double, the triple double, the body double, the somatic double. There's all sorts of different types of psychodramatic doubles that have been created over the years. I'm going to try to just keep it simple today and talk about classical psychodrama doubling. So the Morenos, when they used doubling, they primarily enrolled an individual in the role of the double. And this individual would stay in that role, stay with the protagonist, and offer doubling statements throughout the entire psychodrama. Oftentimes, this was either another participant in the group or a trained staff member that understood how to effectively use doubling. Nowadays, doubling also gets integrated into psychodrama through the director using doubling statements, or by inviting audience members to come out from the audience and to offer a single doubling statement and then to go sit down. The way that psychodrama doubling looks in an actual psychodrama is that the protagonist will be having a discussion with another role in the psychodrama scene, and somebody might come and stand next to the protagonist and offer a statement from the perspective of the protagonist to the other role, a statement that they think hasn't been articulated yet, that might label or deepen the internal experience of the protagonist. Just one sentence. And the protagonist is invited to consider if that fits for them or not. If it fits for them, they're encouraged to repeat it in their own words to the other role. And if it does not fit for them, they're encouraged to change it and change it to something that does fit for them. So doubling is a really helpful intervention, especially for trauma survivors, in that it helps the protagonist or the client to sort out, differentiate their internal experiences, and to accurately label and express what's going on for them internally. Helps them find words for what they might not previously have words to express related to the trauma or the sensations in the aftermath of trauma. It can help them express unexpressed feelings. It can help integrate new cognitions and new perspectives. It can promote a sense of integrative catharsis, and it can help a trauma survivor develop a more coherent internal narrative about their experience of the trauma and their experience in trauma recovery. Doubling is a way for other group members and the therapist to show the protagonist that you're with them, that you empathize, that you're attuned to their experience, that you understand, that you're fully witnessing what's going on. It provides a sense of social connection and safety for the protagonist. And because of all these reasons and ways that it's important, doubling really is a trauma-informed and trauma-focused intervention within the psychodrama modality.